Hi everyone, today we'll be discussing about anatomy of retina. So as you know, retina is the innermost tunic of the eyeball. It is a thin, delicate, transparent membrane which is considered to be a highly developed tissue of the eye. So why it is considered to be a highly developed tissue? Because it is a neurosensory part of the eye which is responsible for a complex mechanisms which are happening within a very small part. So and the color on ophthalmoscopy examination, you can see orangish color, like a purplish red, that is orange color of the retina. So anatomically, coming to the gross anatomy, it is divided into optic disc, macula, and the peripheral retina. So it extends from the optic disc to the ora serrata. So what is optic disc? Optic disc is nothing but a structure which is pale pink in color, well defined circular area. It is a circular or oval with a diameter of around 1.5 millimeter. So this is nothing but a part where all the other layers of the retina terminate except the nerve fiber layers, which are passing through the lamina cribrosa, and they are forming the optic nerve. So you can see in this picture, so the round structure through which the vessels are arising, that is the optic disc. It's approximately around 1.5 millimeter in diameter, and all the layers of the retina are terminating here except the nerve fiber layer which are passing through the optic disc. So next comes the macula. So you need to remember, macula is the most sensitive part of the retina. So why? Because I'll be telling you later. So the anatomy of macula, it is approximately around 5.5 millimeter in diameter. So in this picture you can see, like adjacent to the disc within these arcades, there are three circles which are marked. So that area is the macula. So it is situated in the posterior pole of the eyeball, temporal to the disc. So the nasal to the two parts, like nasal to the disc and temporal to the disc. So macula is located temporal to the disc, and it is also called as yellow spot. I'll explain why it is called yellow spot. And the primary function of the macula is photopic vision, that is vision in bright light or daylight. So this macula is again divided into different parts. So within the macula there is fovea centralis, which is central depression in the macula, which is approximately around 1.85 millimeter in diameter, and it is the within the macula, this is the sensitive part of retina. So within the fovea you have a smaller part, around 0.35 millimeter part, that is called foveola. So within this there is a tiny depression in the center of foveola. So within this foveola there is a tiny depression that is called the ambu. So this is the reason it is called yellow spot, because within this tiny depression you can see a foveal reflex on examination of fundus. So you can see in this picture, so the macula, within the macula, so the macula is approximately around 5.5 millimeter. Within this there is fovea centralis or fovea, so it's around 1.85 millimeter, and within that there is foveola, which is around 0.35 millimeter. So this fovea centralis is the most sensitive part. Within this foveola has more concentration of cones, and at the center of the foveola there is a tiny depression which is called the ambu. Because of this depression there is a foveal reflex. So then coming to the peripheral retina. Peripheral retina, based on the anatomy, which is, if it's adjacent to the disc and the macula, it is called the, after the posterior pole, if it's just adjacent to the posterior pole, it is called near retina. Then comes the mid retina, and then the far retina and ora serrata. You just need to remember. So why this is important, the anatomical location. So I mean, for us to plan for the approach and to and to know the prognosis of the disease. So if it's in the posterior pole or in the near periphery of the retina, so we need to be careful, and we will approximately know the prognosis of the disease. Then microscopic structure of the retina. So as I have already told you, this is a quite complex structure. Within this small diameter, you have almost 10 layers in the retina. So you need to know about each layer. Just right now you know the names of the layers. So the outermost layer, either you have to come from outer to inner or inner to outer. So for the convenience sake, outer to inner is better. So the first is the retinal pigment epithelium. So the retinal pigment epithelium, like you can see in this picture, the outermost layer is a retinal pigment epithelium, followed by layer of rods and cones. Then comes the external limiting membrane, then the outer nuclear layer, then comes the outer plexiform layer, then inner nuclear layer, inner plexiform layer, a ganglion cell layer, a nerve fiber layer, and internal limiting membrane. So you need to by heart this. So it's not so difficult. Once you know the importance of each layer, it will be relatively easy. I'll be going to discuss about all these layers in the coming slides. So this is another picture which is given in the Kansky, so depicting the layers of the retina. So similarly here you can see histopath picture of the multiple layers in the retina. So coming to the outermost layer, that is a retinal pigment epithelium. So this is made up of layer of hexagonal cells that contain pigments. So it is you need to remember, it is firmly adherent to the underlying Bruch membrane. Bruch layer is nothing but a layer of choroid, whereas it is loosely attached to the layer of rods and cones, which is a part of retina. So there is a potential space between these two, between the layer of rods and cones and the retinal pigment epithelium, because it is very loosely adherent. So there is a chances of seepage of fluid within this layer, which in turn can lead to retinal detachment. So in the pathogenesis of retinal detachment, this is important. So retinal detachment is nothing but separation of retinal pigment epithelium from the retina. Retina means neurosensory retina. All the other layers other than the RPE are called other than RPE or retinal pigment epithelium are called neurosensory retina. So what are the functions of RPE? So RPE, as it is just adjacent to the layer of rods and cones, it is responsible for renewal of these photoreceptors, renewal of these rods and cones, and helps in recycling the vitamin A. Another thing is, since it is anchoring the other layers of retina, it provides mechanical support to the photoreceptors, and it also helps in manufacturing the pigments. So there are pigments within the RPE which are responsible for absorbing the light. So it helps in manufacturing of pigments, and they are also phagocytic. That's why they help in the renewal of these photoreceptors. So these are the important functions of RPE. Then next comes the layer of rods and cones. Like you can see in that picture, after the RPE, it is layer of rods and cones. And as you know, these rods and cones, they contain these photosensitive substances which are responsible for visual pathway impulses generated during the visual pathway. So rods contain photosensitive substances called rhodopsin, whereas cone contains iodopsin. So the number of rods is comparatively very large in number when compared to the cones. There are around 120 million rods which are present, whereas the number of cones is just 6.5 million. Though the number of cones are very less, the majority of the cones are concentrated in the macula or the fovea centralis, these cones are the only cells which are responsible for scotopic vision or vision in bright light. So they are very important since they are concentrated more in the macula. So any small lesion in the macula, any disease within the macula can grossly affect your vision during the bright light or daylight. So as I told you, at fovea we have maximum number of cones, and rods are completely absent in the fovea. So this is the density of the rods and cones. So you can see, though the number of cones are less in the fovea, you have maximum concentration, almost around 1,99,000 cones per millimeter square. Whereas concentration of rods in the other parts of the retina, in the fovea they are absent, in the other parts of retina is around 1,60,000 rods per millimeter square, whereas cones concentration is very less in the peripheral part of the retina. So this is the picture depicting the rods and cones. So there are anatomical differences between the rods and cones that if possible we just go through it. Then comes the external limiting membrane. External limiting membrane is nothing but a fenestrated membrane through which uh, which extends from ora serrata to the optic disc, and the processes of these rods and cones, they are passing through this external limiting membrane. See, the layer of rods and cones, they contain only the outer segment of the rods and cones, whereas the inner segment is present in the outer nuclear layer. So these rods and cones are passing through this external limiting membrane, and it is formed by the junction between the cell membrane of these photoreceptors and the Muller cells. So then comes the outer nuclear layer. I told you the outer part. So you can see the outer part. In cones it is cylindrical, in case of rods it is rectangular. Only that part comprises the layer of rods and cones, whereas they pass through the external limiting membrane, and the nuclei of these rods and cones, they are present in the outer nuclear layer. So these nuclei, they lie in single layer next to the external limiting membrane, and they form the outer nuclear layer. So as you know, the concentration of rods is more throughout the retina except the fovea. So these rod nuclei, they are forming the bulk of this layer throughout the retina except in the cone dominated foveal region. So in majority of the outer nuclear layer is made up of rods except in the fovea. So then comes the outer plexiform. Plexiform is nothing but plexus. So you need to remember, plexiform is nothing but synapses. So outer plexiform layer is nothing but synapses between the rods and cones with the bipolar cells. So this also you need to remember. As you know, any nerve fiber will have an axon and a dendrite. So dendrites of these bipolar cells are they are forming synapses. Synapses between the rods and cones with the dendrites of these bipolar cells. This is the outer plexiform layer. You can see in this picture, rods and cones, they are synapsing with the bipolar cells. That is the outer plexiform layer. Then comes the inner nuclear layer. So as you know, the inner nuclear layer, bipolar cells must be present, because rods and cones are synapsing with these bipolar cells. Along with the bipolar cells, there are other cells also which are present, which each and individual cells have their own functions. Like the other cells are horizontal cells, amacrine cells, Muller cells, and even central retinal vessels and other glial cells are also present. So each and every cell has its own function. They are responsible for lateral pathway, vertical pathway. So you can see in this picture, along with these bipolar cells, which are synapsing with the rods and cones, there are multiple other cells like horizontal cells or amacrine cells and Muller cells. And just look at the picture. So these comprises the inner nuclear layer. So it is easy. So the rods and cones nuclei, they comprise the outer nuclear layer. Then comes the outer plexiform layer, which is nothing but synapses between these rods and cones with the dendrites of these bipolar cells. Then comes the nuclear layer, which comprises nuclei of bipolar cells, and along with that other cells are also present. Just try to remember the names like horizontal, amacrine cells and Muller cells. Then comes the inner plexiform layer. Inner plexiform layer is nothing but synapse between these bipolar cells and the next layer, that is the ganglion cell layer. So there is a synapse between these bipolar cells, because the information has to be passed from rods and cones, which comprise the first order neuron, to the ganglion cell. So it is happening through these bipolar cells. So they consist of synapse between these bipolar cells and dendrites of these ganglion cells. And you need to remember they are absent. This layer is absent at fovea. Then, because the ganglion cells are absent in the fovea, and next comes the ganglion cell layer. So, ganglion cell layer, it consists of, this consists of the cell body and nuclei of ganglion cells. With these ganglion cells, they comprise the second order neuron. Like I told you, first order neuron are rods and cones. Then these bipolar cells are just a mediator for that. Then comes the ganglion cells, which form the second order neuron, and they are absent at fovea. And similarly, the outer plexiform layer, the inner plexiform layer is also absent at fovea. And there are different types of ganglion cells. You just need to remember the names. Each and every cell has its own function, like WXY ganglion cells, P and M ganglion cells, that is, which is responsible for parvocellular pathway, color pathway, or magnocellular pathway, which you would have read in physiology. Then off center and on center cell, and monosynaptic and polysynaptic cells. So this comprises the ganglion cell layer. Then comes the nerve fiber layer. Nerve fiber layer is nothing but axons of these ganglion cells. So dendrites are synapsing with the bipolar cells, whereas the axons are forming the nerve fiber layer, and they are unmyelinated. This is important because in some cases they can get myelinated, and you can see the color of the retina appears to be white in some parts, because myelination will lead to white color of the nerve fiber layer. So you need to remember, these are unmyelinated axons of ganglion cells, which converge at the optic nerve head to form the optic nerve. So all these nerve fiber layer, they converge at the optic disc. So the arrangement of these nerve fiber layers is important, because based on this there are field effects which you see in glaucoma. So here you can see in this picture the nasal fibers from the nasal half of the retina, they are coming and directly to the optic disc as superior and inferior radiating fibers. So that is the nasal fibers. Then the papillomacular bundle is nothing but from the macula to the disc. Disc is called papillae, and macula, So this papillomacular bundle is a straight bundle. So this is very important. So as you know, cones are very important for vision in bright light. So any lesion in the macula or any lesion in the papillomacular bundle will cause a significant vision loss in bright light. So whereas other fibers from the retina, from the peripheral temporal retina, they are curving around this papillomacular bundle in an arcuate fashion to form the superior arcuate fibers and inferior arcuate fibers, and they are converging into the optic disc. So this is the arrangement of the nerve fiber layer within the retina. Then comes the internal limiting membrane, which comprises basically of a basement membrane and other collagen fibers or proteoglycans and plasma membrane of Muller cells and so on. So coming to blood supply of retina, this is very important. I think I've sent a vascular occlusion PPT, which is very important for you. They ask central retinal artery occlusion as a short note or a long note also sometimes. So blood supply of retina, you need to remember the outer four layers of the retina is supplied by choriocapillaries, because the choroid is a highly vascular layer which comprises of multiple blood vessels. So and the outer four layers of the retina is supplied by them, whereas the inner six layers of the retina is supplied by central retinal artery. So and fovea, basically it is mainly supplied by choriocapillaries. It is not supplied by central retinal artery. Very rarely, in 30% of the eyes, there is a ciliaretinal artery which is branching from this ciliary circulation, that is choriocapillary ciliary circulation, which supplies part of inner retina mainly at the macular region. So why this is important? Because last time I told you, if patients having ciliaretinal artery in cases of central retinal artery occlusion, if this is spared, because it is arising from the it is arising from the ciliary circulation, if this can be spared And as you know, this macula is the most sensitive part of the eye. So if it is spared, if the papillomacular bundle is spared, there are relative chances of some visual acuity which can be left even if there is a central retinal artery occlusion. So people having ciliary retinal artery, they are at a less risk of completely losing the eyesight if there is a artery occlusion. So macular region is supplied by superior and inferior temporal branches of central retinal artery, whereas the fovea, that is 1.85 millimeter of the center part of the macula is supplied mainly by choriocapillaries. So this is a picture depicting the retina circulation. There are superficial capillary plexus and deep capillary plexus. The superficial capillary plexus, they are happening in the nerve fiber layer, whereas the deep capillary plexus, they occur in the inner nuclear layer and outer plexiform layer. So thank you.